Hyperthermia is very different from fever. Fever is the body's regulated response to a new set point temperature. Hyperthermia, however, is an unregulated body temperature and is associated with high morbidity and mortality. You don't want to miss it. The two most common causes of hyperthermia are drug-induced. Think about this in a patient exposed to inhaled anesthesia or antipsychotic medications. And heat stroke caused by external environmental factors. Think about this particularly in elderly during times of heat waves in those with no access to air conditioning. There are three major drug-induced hyperthermias. Malignant hyperthermia is caused by a faulty calcium channel receptor, thus increasing calcium and causing uncontrolled muscle contraction. Dantrolene can be used as a reversal agent. Serotonin syndrome is caused by drugs that increase serotonin levels, classically monoamine oxidase inhibitors, or MAOIs. Patients have hyperreflexia, large pupils, and clonus. Cyproheptadine, a serotonin antagonist, can be used as an adjunctive therapy. Neuroleptic malignant syndrome, or NMS, is caused by antipsychotics. Presentation can occur up to 8 days after exposure, as opposed to the 24-hour window with other drug-induced causes. Patients are hyporeflexic and have normal pupils. There is no effective antidote. Rapid cooling is the main therapeutic intervention for all hyperthermias, regardless of cause. Ice bath submersion is the most effective means of cooling and must be done as quickly as possible. Antipyretics are not effective in these patients. Patients with drug-induced hyperthermia may need intubation.
So the first question is, what's a high fever? Well, we consider a fever anything over 100.4 degrees taken rectally, anything over 99 degrees taken in the armpit, although that's not a terribly accurate way to measure temperature, or anything over 99.9 degrees taken under the tongue. There are also ear thermometers, which are read like an oral temperature but may not be terribly accurate, and more sophisticated temporal artery thermometers. When your fever gets over about 102, we start thinking that there may be something more going on than a simple virus. When a fever reaches 104, we recommend calling your doctor for advice, and if it's over 105, your child should probably be evaluated within the next several hours as opposed to waiting for the next day. I want to clarify here, though, that's not because fever is going to hurt your child. Fever does not harm children. That is one of the most common misperceptions, even among some physicians. While fevers may contribute to febrile seizures, bringing fevers down aggressively does not seem to prevent febrile seizures, and febrile seizures don't seem to cause any permanent damage to children who get them. So be cautious when you're trying to bring a fever down. It's fine to use Tylenol if a child is over 2 months of age, or ibuprofen, which is Advil, or Motrin over 6 months of age. We used to tell parents to alternate the medicines. We no longer recommend that. We think there's a greater danger of a child being overdosed, and it doesn't seem to work any better than not alternating. So pick one that works for you and feel free to stick with it, knowing that if you have to use the other one, you can. We might recommend a lukewarm bath to help a child with comfort, but don't try and put the child in a cold bath or take him outside in cold air undressed. You're just going to make the child that much more uncomfortable and not to benefit the child. So remember, with fever, if it's over 104, you should call your doctor for advice and have the child seen within 24 hours. If it's over 105, seek care within the next hour or two to find out what is causing a fever of that height. But remember, don't do anything extreme to bring the fever down.